I'm super excited to introduce our presenter, Andrea Emerson, who is Director of Medicaid Eligibility and Benefits. And then with that, I'm going to pass it right over to Andrea to get started. And I will get that slideshow up for you, Andrea.
Hey, hello everybody. Thank you for having me tonight. I'm really excited to be here. As Kate said, my name is Andrea Emerson and I'm the Director of Medicaid Eligibility and Benefits. Okay. So I support care management at both CCOs, Life Plan and ACA with complex benefit and entitlement situations. Today I'll be presenting on some common misconceptions that I've seen recently and over the years. So hopefully we can clear up some confusion pertaining to certain programs and the rules that accompany them. So we're going to go through a lot of information tonight, so we'll get right started. Thank you, Kate.
Are you able to see my screen?
Yes.
Perfect. All right, I'll move on to the next slide then.
Thanks. So our first slide is the misconception being for kids under the age 18, parents do not need to provide income information to Medicaid. So particularly for children who are participating in the home and community-based waiver, that acronym is HCBS, Medicaid allows their parents' income to be waived or excluded, which would otherwise make the child ineligible for Medicaid. It's very important for parents to know that even if their income is not being counted, they still have to provide the information to Medicaid, both at application and recertification. This is a requirement by the state, and Medicaid is required to have the income information on file in the event they're ever audited. Well, not ever, I guess when they're audited. And as we know, during the public health emergency and even the unwind, this rule wasn't always enforced, but this is certainly not a change. This has always been the expectation. So I just wanted to reiterate that HCBS, Home and Community-Based Waiver, enrollment does not allow someone to choose not to provide the information. It just waives the income.
Hear them?
Oh, you cut out at the end of that. Hold on. I think someone might not be muted. Let me just make sure everybody's muted. And just the last bit got cut off. I'm so sorry, Andrea.
No problem at all. So the last bit was just reiterating that HCBS waiver enrollment does not allow someone to choose not to provide the information. It just waives the income from impacting eligibility. Next slide. The next slide, the misconception indicates that Medicaid and Social Security do not count my trust, so I do not need to provide them with proof of my trust. So much like the last slide, even though the value of the trust and/or ABLE account is not counted towards the resource limit for needs-based benefits, proof that the account exists still needs to be submitted during those periodic reviews to both Medicaid and Social Security. They have to approve the trust internally. Both Medicaid and Social Security have their own process in doing so. There needs to be specific language throughout the trust that states that the value of the account should not be considered for government assistance programs, such as Medicaid and Social Security, and then what will happen to the funds upon death of the beneficiary. They also need to know the value of the trust so they know how much to disregard towards the countable resource limit. Next slide. The next slide, the misconception indicates that Social Security Disability Insurance, or SSDI, and Disabled Adult Child Benefits, or DAC benefits, are the same as SSI, Supplemental Security Income. This is, of course, not true. Although they're all offered through the Social Security Administration, they differ in many ways, so I thought that we could compare the programs. SSDI and DAC are both referred to as Title II benefits, which are considered earned benefits, much like retirement and survivor benefits, where SSI is referred to as the Title XVI program, which is a needs-based benefit. If you're on SSDI or DAC, you automatically become eligible for Medicare health insurance after 24 months of your established onset date, which basically just means that you've been in receipt of that benefit for 24 months. The established onset date, or you may see the acronym EOD, is the date that Social Security determines your disabling condition prevented you from working substantially. With SSI, you automatically become eligible for Medicaid health insurance, which means you no longer have to submit an annual recertification. The coverage is automatically renewed each year as long as the SSI remains in pay, which a lot of people ask what in pay means. That just means that you're receiving a cash benefit from SSI. Even if it's only $20 a month, that will keep the Medicaid automatically active. For people on SSDI and DAC, everybody earns different benefit amounts because the benefit is based on earnings. So you may ask, whose earnings? So for SSDI, the benefit is based on someone's own work history, and the DAC benefit is based on their parents' work history. For SSI, the benefit amount is capped each year. So in 2025, excluding the state supplement, no one can earn more than $967 a month in federal funds. This amount can be reduced by other sources of income, of course, or someone's living arrangement. But if someone's receiving $967 every month, that's an indication that they're on SSI. SSDI and DAC are both considered earned benefits because they're based on someone's work history, either their own or a parent, and they paid enough in FICA taxes or payroll taxes to be insured for these programs. You earn insured status by working and earning quarters of coverage. Where SSI is considered a needs-based benefit and is available for people who weren't given the opportunity to work, such as children or people who didn't work enough. So now let's talk about the resource limits for these programs. For people collecting SSDI or DAC, although Social Security does not impose a resource limit, because you're receiving OPWDD services and also on Medicaid, you must adhere to Medicaid's resource limit each year, which this year is $32,396. If you participate in the DAC budgeting program through Medicaid, in order to avoid paying a spend down, you must keep your resources below $2,000. And unfortunately for SSI, the resource limit is the same as it has been for about 30 years now, which is $2,000 for an individual and $3,000 for a couple. For people who are working and collecting SSDI or DAC, their income limit for earned wages is SGA, or substantial gainful activity. Every year, the value of SGA changes. This year in 2025, it's $1,620 for someone who is not blind, and it goes up to $2,700 a month for someone who is blind. For SSI, they count wages slightly differently. There's a formula that Social Security uses in order to determine the amount of countable wages. Social Security excludes more than half of someone's gross wages before it impacts their benefit amount. So in 2025, the break-even point, or the BEP, is $2,019 a month, which just means that after applying that formula for someone working
Oh, I'm so sorry, Andrea. And I'm not sure if it's the same for everyone else. Your audio is kind of cutting out and being a little quiet. Kevin, I can see you on the screen. Kevin, is that happening for you? Audio is a little quiet. I don't know.
Oh goodness, let's see.
It's mostly good, but from time to time it'll kind of come out. So maybe just don't move too much.
Okay, I won't move.
Just
Okay, so
stay very close and still. No. We'll do our best. We always do.
I'm sorry. Did you
Some
hear the
people say
information?
working fine. Great. Okay.
Okay, good. Okay, so let me just reiterate, the break-even point for SSI, the BEP, is $2,019 a month in gross wages, which just means that everybody always, for Title II, for SSDI or DAC, there's that concrete numeric figure, which is SGA. You can't go over that if you want to continue to be eligible for those benefits. And a lot of people on SSI ask, like, how much can I earn? And it's a little more complicated because of the formula that Social Security uses. But the 2019 number is the break-even point, which means if somebody is working and earning that amount in gross wages,